Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through December 23rd, 2021. I want to start by wishing all of you a very happy holiday season and a wonderful and hopefully healthy new year. This week, I'm going to cover two basic topics. Continue with the trend that we've been doing the last couple of weeks, which is what's happening with the current surge. And then a quick summary of news from the past week. Comments on the status of the Omicron variant, the FDA authorization of an oral antiviral treatment for COVID, and then the potential availability of home test kits. So in terms of the current surge, we've been watching this up and down pattern with the pandemic, with cases going up and down. And if you look, it looks like the number of cases is pretty much at the highest level it's been, except for the surge in the early part of this year. Fortunately, we're not quite seeing the same pattern with deaths, though it's leveling off. So we've had 5.4 million deaths to date and about 6,700 deaths a day. So the number of deaths isn't following the increased number of cases, which is good news, but it's still certainly not as low as we'd like to see it. In terms of the United States, we're seeing the same pattern, this upsurge in cases, again, now at the second highest level that it's been. But fortunately, we're not seeing the same increase in case and in deaths, though as before, the number of deaths is worrisome. 833,000 deaths to date, over 1,250 deaths every day. So again, it's not as high as it was in the three previous surges, but it's certainly not as low as we'd like to see it. And hospitalizations are going up as well. Again, not as high as they have been, but again, we don't see the pattern yet of whether they're coming back down or not. About 7,800 admissions a day, and that's a 4.4% increase over the last week. So we'll keep an eye on that as well. In terms of Tennessee, we're not even seeing really a great increase in the number of cases or in the number of deaths. It's sort of been about the same for the past couple of months, over 18,000 total deaths and 40 to 50 deaths a day. So again, hopefully we're not going to see a huge increase, but the odds are pretty good that we will, because if you look at hospitalizations, they are coming back up. Again, nowhere close to where they've been before, but they're definitely coming up. And if you look at where cases are in the U.S. right now, you see this pattern sort of from the Northeast down to the mid-central northern part of the country, and not really in the South, in Tennessee, and so on. Now, historically, that will change, and we'll see these cases starting to occur in the Southeast as well. In terms of ballot health, we've seen a slight decrease in the past week in terms of total hospitalizations. But as always, the vast majority of the people in the hospital, 91%, are not vaccinated. 93% of those in the ICU are not vaccinated, and 93% of those who are intubated are not fully vaccinated. So regionally, nationally, and around the world, vaccination appears to be the single most important thing we can do to reduce injury and death from this pandemic. In terms of the past week, we've been following the resurgence, the occurrence of the Omicron variant. It's now been reported in most states and is considered the predominant strain in the country. The WHO, World Health Organization, reports it in over 6 countries. It does appear that the Omicron variant spreads much more easily than previous variants. And it may or may not be true that it causes less severe disease. It appears to be increasingly likely that that's the case, but we're not absolutely sure yet. And the CDC is concerned that because of the rate of spread, the ability of this variant to spread, that we're going to see a rapid increase in infections in the next couple of months. They report, however, that while there are breakthroughs with Omicron, vaccines remain the best public health measure to protect people from COVID-19. And this is an interesting slide. This shows you what the predominant variant has been since September. And the orange one is the Delta variant. And you can see until about 3 weeks ago, it was overwhelmingly the variant. But now 73% of new cases in the United States are believed to be the Omicron variant. So this exploding number of cases does suggest it is probably much more highly transmissible than even the Delta variant. Good news on the treatment side, the FDA has authorized a oral antiviral treatment, Paxlovid. It's a combination of 3 pills, 2 different pills, for the treatment of mild to moderate coronavirus disease. So those who test positive and who are in a high-risk setting or high-risk individuals themselves. It should be started as soon as possible after diagnosis within 5 days of symptoms. The data for it were based on this. About 1,000 patients were treated with Paxlovid and about 1,000 with placebo. 0.8% of the treated group were hospitalized or died during the month follow-up compared to 6%, so about a 90% reduction. That's good news. But there's a couple of caveats here. There are a number of important side effects and especially a lot of drug interactions that your physician really needs to pay attention to. And I've included a link there that you may want to copy if this is an issue to you. The second issue is that even though this has been approved for emergency use authorization, the supply is very low. So for the moment, it's something promising on the horizon to have an oral treatment. Most of the other treatments are intravenous or injectable. So this is good news. The other good news is the potential availability of home test kits. In a press conference, President Biden announced that the government will purchase 500 million test kits, and they'll be available for folks who request them. But again, they're not yet available. These are antigen test kits that identify small quantities of viral particles. And because of that, there is the possibility of a false negative test, especially if you're tested too soon after exposure. So some are suggesting that you should repeat testing. If you need to be tested twice, 2 to 3 days apart. Remember, though, testing only helps if it's used appropriately. That's for people who have symptoms, people who have been exposed to a known positive, people prior to a large group exposure, and especially prior to contact with someone at high risk. Obviously, the testing doesn't do any good if it isn't done, and it doesn't do any good if someone who tests positive goes about their normal course of business. So again, the test kits are a promising step forward, but they're not a panacea, and they need to be used appropriately. So the surge, we're continuing to watch this significant increase in cases and a leveling off of deaths. The Omicron variant is now widespread both in the United States and around the world. There's good news in terms of the potential for an oral treatment and potential availability of home test kits. However, having said all of that, the Omicron variant does not change the importance of vaccination and control of COVID-19, and the antiviral treatments and the home test kits do not take the place of vaccination as the gold standard for controlling COVID-19. All of the data continues to show that the vaccines are safe and effective and are probably the only real hope we have of limiting the long-term impact of this pandemic. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. Thanks as always to Dara Young for editing, producing, and posting this video. And if you have any questions or comments about this video or about COVID-19 in general, please let me know. I look forward to hearing from you. Until next week, I hope you have a happy holiday and be healthy. Thank you very much.